So, what's the single biggest health challenge facing Australia today? It's chronic disease. But here's the thing, there's actually a national game plan to fight back. Today, we are going to unpack Australia's official strategy. Think of it as a four-part battle plan designed to build a healthier future. And trust me, it affects you a lot more than you might think. I mean, we all want to live longer, healthier lives, right? We try to make good choices. But how do you get an entire country on the same page? What does a national level strategy for keeping people healthy, what does that even look like in practice? Well, Australia's answer is this really detailed strategic framework. And what we're going to do is break it all down into a simple four-part battle plan. It's a super focused approach designed to systematically push back against the chronic diseases that affect millions of people. All right, part one. The very first front in this battle is all about the primary line of attack, hitting those preventable risk factors head on. This is where the fight really begins, by tackling the root causes of chronic disease before they even get a chance to take hold. So this first part of the plan is broken down into 5 key priorities, all seen as equally important. You can see them right here. Each one of these, from cutting down on smoking and harmful drinking to improving what we eat, getting more active, and tackling obesity, is a critical lifestyle factor where big national efforts can have the biggest possible impact on our health in the long run. Now, any smart plan knows you can't just treat everyone exactly the same because not every community is starting from the same place. And that's why the second front of the strategy is all about protecting specific populations and making sure everyone has a fair shot at good health. The framework gets really specific here. It actually identifies 4 priority groups that we know carry a heavier burden of chronic disease. We're talking about Indigenous Australians, folks living in rural and remote areas, people from diverse cultural backgrounds, and those facing socioeconomic hurdles. By focusing support right here, the strategy aims to close that health gap for good. Okay, so we've reduced risks and we've put protections in place for vulnerable groups. What's next? Well, the third part of the plan is basically an intelligence gathering mission. It's all about finding potential problems way before they turn into full-blown crises. But let's be real, prevention can only go so far. So the big question is, how do you fight a disease that might already be quietly developing inside someone, long before they even have any symptoms? The answer is all about being proactive. The strategy leans heavily on a really robust system of early detection. Think of things like the national cancer screening programs, or when your GP checks your cardiovascular risk, or those widespread diabetes checks. This whole system is designed to find the enemy, those very first warning signs of disease, long before it can launch a major attack. Now for the fourth and final part of this battle plan. And honestly, this one might just be the most ambitious of them all. It's about completely transforming the way our healthcare system is structured, moving away from all those disconnected appointments to a truly integrated health team.
And this slide just says it all, doesn't it? I think a lot of us have lived through that fragmented care on the left, repeating your story over and over again to different specialists who don't seem to talk to each other. The goal is to get to that model on the right, a single, connected team that works together and actually empowers you to help manage your own health.
And we've got to be clear, this isn't just a small adjustment, it's a massive shift in thinking. The whole idea is to have this seamless flow of care. The system should be able to support you no matter where you are. At home, at the GP, at a specialist, with one consistent team that knows your whole health story. So there you have it, the 4 fronts of Australia's health battle plan. It's actually a pretty powerful and logical flow when you think about it. First, reduce the risks, then protect the most vulnerable, find any issues super early, and finally, wrap everything up in a seamless, integrated care system. And that right there, that's really the key takeaway. This whole framework isn't just some dusty government document sitting on a shelf. It's a shared vision that directly impacts the health advice you get, the screenings are offered, and the way your doctors and nurses all work together for you. So I'll leave you with this question to think about. Now that you understand the National Battle Plan, this huge focus on prevention, early detection, and coordinated support, how can you use that knowledge to become a more empowered leader on your own health journey?